Action.
My name is Dr. William Bateman, one of the founding board members of Stand Up for SMA, joined by my tame skeleton bones. Through this nonprofit organization, our goal is to increase global awareness of spinal muscular atrophy, a genetic disorder or condition affecting 10 to 25,000 children and adults in the United States. You might be asking yourself, what is SMA? SMA is a group of genetic diseases that affects motor neurons in the spinal cord. This is what the spine will look like with it and without it. This disorder leads to progressive muscle weakness and atrophy in the muscles surrounding the spine. Over time, signals from the brain are no longer able to reach the spinal muscles, and the patient's spine begins to weaken and curve due to a lack of supportive musculature, just like in this picture here. In addition to muscle weakness and tone, patients may experience trouble with movement, they may have some respiratory issues, and also have problems with swallowing. This is a genetic disorder, meaning people are born with it. It is caused by a mutation or change, just like up here. We can see that there is a 25% chance of getting it. And this happens in the SMN1 gene. The most common form of SMA has an autosomal recessive inheritance pattern. The SMN1 gene, or survivor motor neuron 1, has a mutation which is a homozygous deletion of exon 7 in that gene. The average human has 2 copies of the SMN1 gene on chromosome number 5. In one, or in rare cases both, aren't working, then the odds may not be in your favor and you might just have SMA. You may be inclined to start thinking to yourself, does all this just affect just a gene? Or another example maybe, does this affect just one cell? Well, I'm sorry to inform all of you viewers that you guys are all incorrect. All the mutations in the chromosomes will be used in the processes of transcription and translation. During transcription, nothing much is really changed out of the ordinary, but during translation, the mRNA, it has changed due to that changed chromosome. So, there's a whole new and completely unwanted protein. So some of the symptoms of SMA depend on the type that you get. There is a chart up here about all the types. There are 5 different variations of this disorder, labeled 0 all the way up into 4, going from most severe to least severe. Regardless, some of the symptoms you may get include weakened muscles, you may have some respiratory problems, difficulty swallowing foods, some involuntary twitches, contractions, and fatigue. Now, some other effects of SMA can include poor muscle tone, joint problems, scoliosis, and more. Now, people can live different lifespans with SMA. People with type 0 and type 0 and 1 can have a life expectancy of less than 2 years without treatment. That is crazy to me. People diagnosed with type 2 can have longer life expectancy, though they may need a wheelchair later in life. But on the other side of the spectrum, with types 3 and 4, people with it can live near normal and near normal lifespans. Now, there are ways to diagnose it through several clinical assessments and genetic testing as well, mainly looking at the SMN1 gene. Currently, there is no cure for SMA, but there are several therapies that can help slow and reduce the symptoms of SMA. Some of those therapies also happen to be gene therapies, including Zolgensma, which is a one-time gene therapy to correct the faulty SMN1 gene. There's also Spinraza, which is an injection given to the spinal canal to help with the muscle stuff. There's also physical and occupational therapy to help with the physical stuff. There's nutritional and respiratory support. There's speech therapy. And there are also assistive devices and spine support. Alright, so we got into the final part. With your help, we can continue to combat this genetic disease and bring those who are diagnosed and help heal those who are diagnosed. Now, stand up for SMA Awareness is in August. And Stand for SMA is planning a fun run and a silent auction to raise funds and awareness for this worthy cause. If you would like to learn more, please check out one of these 6 great resources to help with your journey to learn more about SMA. And please, donate now.